good afternoon, and thank you for attending today's Student Town Hall regarding the opening for the spring semester. This program is being recorded and will be available via the WCU website. Many have submitted questions prior to today, and as always is the case, several themes have emerged. We will answer those topics first and ask that you please listen to our comments regarding the university's plans regarding the following: 2 weeks of a remote instruction, tech support, tuition and fees, testing, mask, and vaccination protocols, the January orientation, residence and student life concerns, and spring commencement. And as time permits, we will answer any new inquiries that are posed today. President Ferrantino, would you please begin with your opening remarks and overview?
Thank you, Dr. Villella. Well, good afternoon, everyone. I know that there are a lot of questions that have come up around our decision. I can tell you that we did not make this decision lightly. We deliberated extensively, and we're pleased to be here to have the opportunity to explain the rationale behind what we decided to do and to answer the questions that have been submitted. I do want to address one point right out of the gate here. There were a number of comments I saw suggesting that we waited until after the tuition payments were due to make this announcement. I can honestly say that none of us were thinking about tuition or when tuition payments were due. It didn't even come up. It certainly didn't occur to me. I didn't know when tuition was due. But the fact is that anybody who would find our decision to be unacceptable and would choose to leave the university would still be eligible for a full tuition refund right up to the drop add period. If you wanted to leave and go somewhere else, that's certainly possible. And there was in no way this was an attempt to capture your money and then put you in a position to be locked in. You're not locked in. Your money is still available to you should you so choose. Again, I just wanted to make that clear up front. Remember, we're not an organization that's earning profit. The tuition and fees that we receive all go into running this university. So I wanted to make sure that nobody was harboring that. With that, I'm going to turn the microphone over to Dr. Jeff Osgood, who's going to start to address the questions that have come in regarding our decision, the rationale, and various aspects of what we're going to do moving forward. So, Jeffrey.
Great. I just want to reiterate that what the president has said. It's clearly, we know that the best educational experience we can give students is the one that happens inside the classroom, and that is always our goal. But intersecting with that is our desire to make sure that we keep our campus community safe and well. And there are questions around why did we decide to just make the remote decision for the first 2 weeks. We are looking at a variety of public health data coming from the CDC, the Pennsylvania Department of Health, the Chester County Department of Health, and in particular, we're looking at the University of Washington's data that looks at not only the 50 states, but is looking at global trends. And in fact, what the University of Washington data is indicating is that we crested in the Commonwealth of Pennsylvania around January 6th or 7th. And by February 7th, we will have reached one of the lower points of the Omicron wave that many of you are hearing about. So at this point, we do actually have a high level of confidence that should those estimates hold out, which they have actually proven to be effective. In fact, many major news outlets have referenced the University of Washington model as being an accurate predictor of the presence of COVID in multiple geographies. So we do feel comfortable about returning to in-person instruction within 2 weeks. What people should know about our decision is that the classroom environment is the densest activity we engage in as an institution of higher education. When students interact in the library, they interact in the rec center, or even the student union. Those are spaces in which you are able to practice social distancing. You're able to maintain spacing and additional public health protocols that you are not able to engage in the classroom. Our primary goal here was to address the densest activity we engage in on campus, which is to have students in the classroom. and to provide us the ability to not only ride out the wave using the data that we just referenced, but also to ensure that our students did not experience sporadic losses of faculty. So this is not only are we looking at protecting student health, but we're also looking at protecting the health of our faculty and staff, and also ensuring the availability of our faculty and staff during this. We know that the best educational experience we can provide students is in the classroom. The other decision that we made, which is dramatically different than decisions we've made in the past around the decision to go remote, is that all of our classes will happen synchronously. We know that for our students, being very routine and structured about the educational experience is something that assists them in being successful in the classroom. And so instead of students having an asynchronous instructional environment the first 2 weeks, meaning perhaps they log on and see a video during one of their free time and responding to questions, they will be live with their faculty members during the time that's listed in the course schedule. So we're providing, while we are not providing the in-person instruction that we all have come to appreciate and value, they will have the FaceTime with the faculty during the time that's listed in the course schedule. Another question that's been asked related to our decision-making process is, why have the campus open but not have classes? And so I just want to re-emphasize the point that I made earlier, which is that we are looking to address the densest activity we engage in on this campus, which is the provision of instruction in the classroom. Also, we want to keep the campus open, things like the library and computer labs and meals and dining, because we actually have students who have resource needs that must be met. Not all of our students are fortunate or have the privilege to have some of the resources that others do in their home. Not all of our students have access to food at home. Not all of our students have access to internet. Not all of our students have access to even to smartphones or laptop technology. So the purpose of keeping not only our Chester County campus open here, we are also keeping our Philadelphia campus open so that our students who have resource needs can find those things that they need to be successful during those first 2 weeks here on campus. Dr. Davenport is going to talk about it a little bit more, but we believe firmly that allowing students to return to their residence halls is actually a solid public health protocol. It's a mitigation strategy because we have the ability to better provide a safe environment than many of our students have within their homes. And so I'll let Dr. Davenport talk about that a little bit more. There's been questions around what has to change for us to resume classes on February 7th. And really it is looking at a multitude of data points ranging from the continued presence of the virus within the region. It's also to look at the severity. There are many questions that have come in. If Omicron is so much more is so much less severe in terms of its impact on individuals' health, why are we taking this? Well, there are a couple of reasons. One is we know that Omicron is much more transmissible. We are looking at data that indicates mask usage will need to change in terms of the type of mask for the current variant to be less transmissible. So there are a number of things that we have been monitoring. But if history is any indicator of the future, which we know it is, it's that the University of Washington data has been successful in estimating the curve of the virus. And as I said earlier, by February 7th, we believe that we'll be at the downward trend of that. Clearly, we'll continue to look at that as time progresses. We believe that starting the semester on time is actually something that is in the best interest of students. One, it keeps their schedule intact. It doesn't require us to move spring break. It doesn't require us to extend the semester beyond the current projected end. It doesn't require us to do a number of things. So we believe that maintaining the integrity of the academic semester and not delaying coming to class is in the best interest of students. As the president has said, you actually have through the drop add period, which is January 4th, to receive a full refund on your tuition. So this decision in no way.
Not January, Jeff.
January, so February, sorry, yes. So sorry, February. Thank you, Chris. Sorry, February 4th to receive a full refund. So this decision we believe is transparent and timely. So you can actually make a decision around your attendance at West Chester University and still receive a full refund. So with that, I'm going, in terms of tech support, Again, I want to point to our decision to keep the campus open for students both here at Chester County and Philadelphia. We have computer labs open. Students can go to the FHG library and secure a laptop for a rental period of 7 days. We will have laptops available also for rental in the Philadelphia campus. And also Wi-Fi is available for students at all of those campuses. Should we, while we absolutely do not believe at this point that we will be extending past the February 7th date, if we do make a change, then we will, if we do have to go remote further, we'll reassess that. So with that, I'm going to hand it over to Dr. Davenport.
Jeff, before we leave that topic, just one more thing I wanted to mention about this. We are following the CDC guidelines, and the guidelines require that people who have contracted the virus would be required to quarantine. And when you talk about the faculty and the students possibly acquiring the virus, this could cause, and I've talked to the president of Chester County Hospital, and perhaps you've been reading about the airline industry and food services industry and so forth. But there are large percentages of the workforce who are finding themselves in quarantine. And if that happens in a face-to-face environment, then we could lose a significant number of faculty in terms of being able to be teaching their classes. But in this remote mode, they will be able to continue from home as long as their symptoms aren't terribly serious. So I think that's a consideration that people should also be aware of.
All right, good afternoon. As Dr. Osgood mentioned, I'm Dr. Davenport, Vice President for Student Affairs. We've had some questions around orientation. I will let you know that a correspondence has been sent out to from the Office of New Student Programs for all of those individuals who would be impacted by the 21st, the orientation that's happening on the 21st. If you have any questions about that orientation session, please feel free to contact the Office of New Student Programs. I'm going to answer some questions around some testing protocol questions that we had that came through. Let's see here, let me get to those. One question was pertaining to fully vaccinated students being included in the testing protocol. At this point, we're testing only unvaccinated students due to the testing protocol. However, anyone who has had a known exposure or anyone desiring to have a COVID test may do so on our on-site facility. Not only do we have testing available, but starting on January the 26th, we will commence with our vaccines as well in that site. We had a question about individuals wanting to know how to upload their proof of vaccination. If you go to your MyWCU account and you click on the vaccination record tab, that is where you can upload your vaccination records. Regarding how we define or how fully vaccinated is being defined right now, the CDC guidance is still that two shots from Moderna and Pfizer is defined as fully vaccinated, and one for J&J. Again, we are actually strongly encouraging anyone who is eligible to please get your booster. Again, we'll have that booster shot available on our campus on the 26th. There was a question about requiring testing for commuters who are unvaccinated. And at this time, West Chester University only has the authority to require testing for resident students and for athletes. And again, if you need to upload your vaccination records, please do so by visiting MyWCU and look for the vaccination tab. Dr. Osgood talked very eloquently about why we are not having in-person instructions. That was something that came up around the testing component. And now I'm going to just switch to residence life. And before I do that, Dr. Osgood, is there anything that I missed?
Nope, not at all.
Okay. So the one question was, are students required to come back to campus? And that answer is no, you are not required to move back to campus during the first 2 weeks. However, every resident student was sent a correspondent earlier this week and asking you to inform us as to when you will be returning to campus. We need to know that information, so please look at the email that was sent to all resident students and make certain that you complete that survey so that we will be ready to receive you when you come. And if you choose to stay home, obviously you can, and you have the availability to do so, then you can take your classes synchronously during that time. There was a question about dining. Will dining be available? Yes, dining will be available beginning on the 21st of January. And there were some questions about students who have to return to campus, earlier than the 21st. We will make certain that there will be food accommodations made for those students as well. If you would like to find out the most updated information about dining options on campus, please visit westchester.campusdish.com for more information. There was a question regarding the guest policy. We are continuing to monitor our guest policy at this time, and we will keep students updated as to where we land with that policy. Another important question they're all important, but another good question that I think folks should know about was regarding students who live on campus who test positive. And as you know, those students who are residents who live on campus, we completed a student guest policy, not a guest policy, I'm sorry, a student policy regarding our community. And in that policy, we said that any student who lives on campus and tests positive is required to isolate off campus. And we actually have made arrangements with a local hotel to provide isolation rooms for those students who cannot return home. It's important to know that this is at the student's expense. However, we've made an arrangement whereby we will charge the student's account so that you don't have to pay up front, but you are able to pay your bill for that hotel stay when you're able to do so. Will I still be able to pick up my parking pass and student ID even though classes are remote? Yes, you will. The SSI Service Center will be open their regular hours, 8 to 4:30, Monday, Wednesday, and Friday. Again, I mentioned dining options will be opened fully on the 22nd, but also for those students who are arriving to campus early on the 21st and the 19th, there will be food available in the dining hall and in Sykes. Aramark will keep you posted via social media, Campus Dish, and signs around campus. There was a couple of questions related to clubs and organizations, and an email went out on January 12th to all students and advisors, informing them of the activity for clubs and organizations. We are strongly advising those clubs who can meet remotely to do so. If you have an exemption or a need to meet in person, you can refer to the email that was sent to you and submit your form via RAM Connect. For those individuals who will participate in club sports, a correspondence went out to those individuals, your executive officers today regarding club sports. And if you have any additional questions, please contact the campus rec team. They will be available to answer any questions that you may have. Dr. Osgood, as I'm just looking through here, I think that wraps up any of the questions that I had.
I do see that we did have one question about commencement and where commencement will be. At the present time, we have commencement scheduled for May 13th through the 15th. We're finalizing the times for each of the different colleges at this point in time. Our plan at the moment is to do indoor commencement so that we're not impacted by weather along the way. And as time progresses, we will certainly keep people posted as best we can in regards to what we're doing with all of the commencement exercises. Okay.
There was another question about mask enforcement. And we have a practice that we have utilized where all of our managers and some of our staff members are monitoring masks in and out of the facilities. So whether it's the library, the classroom, psychs, rec center, different places like that, we are monitoring mask compliance. And we've been very diligent with that, and we will continue to do so. I will say to the students that we did learn that toward the end of the semester, students were having to be reminded more frequently. So we are asking you up front to please adhere to our mask policies while you are indoors.
There's a question around, will WCU be providing higher quality masks if CDC recommendations change to a different standard? And the answer is yes. Our Vice President for Finance Administration can talk about that.
Yes, so we've sourced a number of suppliers, and we will have N95s available for students in the classroom. So when you return on February 7th, you will be able to get an N95 mask.
We also had an additional question about the graduation ceremonies, that they are, yes, scheduled to be in person.
Just like to reiterate that clearly this is not what this cabinet nor I think the university community wants to do in this particular situation, but it's actually what the current pandemic requires of us to ensure the safety of our campus community. We continue to look at data. We'll continue to make decisions that are in the best interest of our students. You can see that in the way we're providing remote instruction this time. And there's a question around, will professors be required to hold those live classes remotely? The answer is absolutely yes. We have a strong partnership not only with the deans on this matter, but also the faculty union has been very supportive. So we will be, we have a high level of confidence. And if you encounter a situation in which a professor is not conducting their classes synchronously, you should feel free to reach out not only to myself, but the dean, and we will address it immediately. We understand that the synchronous instruction is a core part of what many students want and expect from their college experience. Where can you park on campus if you want to use the library to Zoom in your classes? So Todd, if you want to take that, but we're gonna be making our parking spots available on campus during that period.
Yeah, I mean, students will still be able to get there, and notice went out if you're parking in the garage or you want to park in the lot. You just need to have your parking pass, but there will be plenty of parking available. We don't expect a large number of folks in there during that time, so there should be plenty of places to park.
Todd, there's a question around how will work study be impacted by this decision. As we've done in the past, we want to make sure this does not have a negative impact on our work study students. So those work study students should actually communicate with their office, but if they can continue that work remotely, then we will allow for that, or in person. If for any reason you're unable to work all of your hours during the first 2 weeks of remote instruction, you will be able to make those hours up later. So we want to make sure that this does not have an impact on our work study students, because it is a very important stream of financial aid for our students. There's a question around, will campus tours still be happening for prospective students? We're currently working with the Office of Admissions and the Office of the Graduate School on this matter. Right now, we have been very successful in conducting on-campus tours with small groups that are social distance with the appropriate mask. So the answer to that would be yes, we're going to continue those with a greater degree of safety than we're able to conduct classes. Again, that's going back to the message that we're addressing the most dense activity we have on campus, which is in classroom instruction. So the answer is, campus tours will still be happening for prospective students. I do want to reiterate a lot of questions come to us around our testing strategy. I want to just restate that as a public institution, we are absent a specific act by the legislature. We cannot mandate vaccines. I think it's important to remind the campus community of that. So that decision is outside of our hands. Similarly, the ability to impose testing is limited to only those students who actually live on campus. So I think it's important for the viewers to understand what legal environment we work in and what the limits are of our decision-making authority on things related to testing and vaccination. There's questions around, it's hard to determine if a class is the right fit while virtual. Will the drop add be extended? We're not planning on extending drop add. However, we plan on being very flexible and working with students on a case-by-case basis. If that happens to be the situation for you, that you find that it wasn't the right fit. I understand that this might be your first semester. And once you get into the classroom, you find out that that's not the right class. We understand that there are impacts to the educational experience for our students and your ability to make informed decisions, and we're going to be flexible with that. We have a question, Todd, around if you're a first-year student and you need to be on campus for a day during this period and they don't have a parking pass.
We can certainly look into that as an option. I would say if you are in that situation to let us know. We can work with the Office of Student Affairs, and then we can certainly accommodate an area for students that need to have access.
And Todd, I think it would be fair that, again, this institution is about student success and meeting our students where they're at. So, you know, we're going to not be taking a hard line around parking enforcement during that remote period, because
Absolutely.
Yeah.
And then, Todd, they can also initiate the parking pass inquiry through your office. I mean, I'm sorry, through public parking.
Correct. Yeah, they can reach out to the parking services in the public safety building as well.
Yeah. And there's a question about orientation. And if you choose to attend orientation virtually, you can do that. That should be in the correspondence. If you have any questions, you can contact the Office of New Student Programs.
I'm going to make another observation. We know very well that there are many schools that have chosen to go ahead and hold classes face-to-face. I've had conversations with many presidents who have anguished over how to handle this current circumstance. And it's important to realize that everyone is making decisions under conditions of uncertainty. None of us know for sure what's going to happen over the next few weeks. And a school that chooses to open face-to-face, it may turn out that we don't have a significant additional number of cases, and it could be that what we decided to do was not necessary. And if that's the case, then we'll simply flip to face-to-face at the end of the 2-week period, and we'll move on with things. My concern is that if a school if we had gone face-to-face, and of course there will be schools that are going to face this challenge potentially, if all of a sudden we start to see significant increases in the number of COVID cases on the campus, it could be severely disruptive of campus life in terms of the offering of classes, the attendance of classes, the availability of the faculty to teach classes. And our decision was based on the premise that since we don't know for sure what's going to happen, taking this course of action minimizes the disruption that we believe the campus is going to have to face. And we are confident, looking at the numbers that Jeff referenced from the University of Washington, that the number of cases will start to drop dramatically and put us in a better position to be able to move ahead face-to-face. I think one of the things to realize right now, compared to last semester, with the Delta variant, what we were seeing was that vaccinated people were really not getting sick in significant numbers, and unvaccinated people were, which meant that people who chose not to be vaccinated were taking that chance. But now we have breakthrough cases with people who are fully vaccinated, and students who've done everything that we've asked, and all of a sudden they may find that they have to be quarantined and they're not able to attend their classes. So again, these were all factors that we looked at in terms of reaching the final decision that starting remotely for the first 2 weeks minimizes the expected disruption of the campus life for that time period.
Thanks, Chris. There's a question for me in particular to provide my contact information and my office hours to report if a professor is not conducting class live. So my typical office hours are 8 to 4:30, Monday through Friday, but you can be assured that I'm here much later than 4:30. And my email address is josgood, so josgood@wcupa.edu. And I'm happy to facilitate working with your students. There's a question around if you want a refund for residential students who now want to become commuter students. It's a great question. We anticipated this. So if you want to remain enrolled in classes but decide not to live on campus, this will impact your cost of attendance. So it will require a financial aid adjustment, and it may impact how much monies are available to you. But that should be expected because you would not be paying for your on-campus housing, but you should contact the Office of Financial Aid and they'll be able to assist you with that.
Depending upon, well, there's a question that relates to athletics here. And it says if the university goes remote past February 7th, I would say that we will be in close communication with the athletic department around what happens with athletics regarding being in a remote status. At this point, we're following the NC2AA guidelines regarding testing protocols and are continuing with our athletic events at the current time.
And if I might just add to that, Dr. Davenport, the PSAC board met and we voted overwhelmingly to continue athletics and continue with the testing. There are different schools who have taken different courses of action, but everybody is still competing as of this time, and we don't anticipate that changing.
I had a good question around what about field placements, internships, student teaching, clinicals? So you should connect directly with your faculty member who's supervising those. I will tell you for things like nursing and student teaching, there are state licensure requirements that require a minimum number of hours. We are continuing those insofar as the host site is allowing us to. We are grateful to our healthcare partners who are continuing to host our nursing students, our respiratory therapy students. We also have physician assistants. And also all the school districts who are continuing to allow our students to make timely progress towards earning their teaching credentials. So students who have an internship, field placement, or clinicals, those individuals should work directly with their students. For the vast majority of them, those placement sites are remaining open, so we do not impede a student's progress in those areas.
There's a question about the MLK blanket meeting event happening. I would encourage you to reach out to the individuals who are organizing that event. Again, that will be based on the ability to socially distance in that space. And those folks will be able to adequately address your question regarding that event.
Have we addressed all of the questions that were submitted to us as of this time?
We've addressed all the questions, not only that we've received in advance, but also that have been put in the chat. But we are in no way trying to rush off this town hall, and please continue to provide live questions. So there's an additional one. Are masks available in buildings? Yes, currently the surgical masks are available at every station, but as we discussed earlier, we are implementing protocols to change those, to add to that mask availability the N95 as well. And we'll have more information on that to share with the campus community in the coming days. But we feel confident that our team in finance administration have done an excellent job in sourcing the N95 masks in advance of impending demand.
A point about the housing for a moment. You're probably aware that university housing and USH housing are operated separately. For students who might be considering switching from housing to commuting, and if you're in USH housing, you will have to contact USH to determine their policies for how they're going to be handling that. That is not overseen by the university directly.
There's a question about the isolation period. We are at this point utilizing the CDC's 5-day isolation period. However, you still are required to wear your mask even after that 5 days to mitigate the spread of any type of virus.
Dr. Davenport, is a person in quarantine required to be tested at the end of that 5 days, or if they're still symptomatic, could they end up being quarantined for more than 5 days?
Yes, thank you. Great question. Our health services department will be in constant contact, actually daily contact with a health checker for anyone who has contacted COVID. And in order to be released and come back to campus, they will follow a certain protocol that you have to adhere to. And based on the requirements that they're utilizing, symptom-free, a certain period of time, then is when you will receive information from them that would release you to come back to class or back on campus. Thank you, President Ferrantino.
But an addition and a question: if the university ends up extending the remote period, which we are very hopeful that we will not have to, will we implement the alternative grading policy, or as it's described in the question, the COVID grading policy? If we get beyond the 2-week remote period, we will absolutely revisit that in consultation with the Student Government Association, the Graduate Student Association, but also the faculty curriculum body. So those are things that we're absolutely looking at. Those are the things that I think were critical to maintaining our student success during the pandemic, and you can be assured that we'll continue to visit that in consultation with all the groups who represent you.
There was a question about reiterating the definition of being fully vaccinated. At this time, according to the CDC's guidance, 2 shots for Moderna, 2 shots for Pfizer, and 1 for J&J constitutes fully vaccinated. And as I mentioned before, we are strongly encouraging anyone who is eligible to receive the booster to do so. And we will have a vaccination clinic on campus starting January the 26th. If that definition changes, we will change our definition.
The question around, is it possible for a student to attend asynchronously? And that will not be possible. To many of the good questions that were provided in advance of this town hall, there's a strong desire by many of our students and quite frankly, also the parents, that there's synchronous instruction provided in a real-time format by their faculty members. And to do that, it means that students must also attend. We must stress that students' attendance is not only important during this 2-week period, but it's important for the entire academic semester. And this is something that we'll be pushing very strenuously over the course of the semester. And there's an additional question around, when cases go down, will you consider loosening the mask mandate? I think that it would be prudent to say that when multiple things happen, this institution will consider loosening the mask mandate. It will not just be based on case count, but it'll also be based on a number of public health factors and guidance from not only the CDC, but the Pennsylvania Department of Health and others.
And I want to just emphasize a point that Dr. Davenport just made. The evidence shows that people who are boosted are much safer, and you can get your booster. If you're vaccinated, you can get your booster here on campus at no charge in our clinic. Correct, Dr. Davenport? So we really encourage people who are not vaccinated to get vaccinated. And if you haven't been boosted, be boosted. I had a conversation with the president of the Chester County Hospital the other day about what's going on over there. They do have a large number of their employees who are calling us sick because they're infected by the virus. But he told me that none of the patients at the Chester County Hospital who are in the intensive care unit, or let me put it the other way around, all of the patients who are in the intensive care unit are patients who have not been vaccinated as of this time. So the vaccines are providing good protection, and the boosters even better protection. So we do encourage you all, for your own safety, to, if you haven't taken that step, please do.
I'm going to take the off-campus testing piece, and then I know the next one is yours. But so there's a question around how do you plan to address the fact that we know students are choosing to test off-campus, so their positives are not recorded in official numbers. Clearly, we cannot require students to share that type of information with us, but one of the ways that we are creating a strong incentive structure for them to share that with us is that we're telling faculty that they are not to provide students with the opportunity to make up missed test exams or to not reduce their attendance grade by any penalty unless they go through their appropriate channels through Dr. Davenport's division. So the way we are incentivizing students reporting that is you cannot get an excused absence for an illness unless you not only provide that information, but go through the clearance process. And so that's, and by the way, every time that we get notification from a student and we verify they're positive, the off-campus positive, we include that in our active case number on the dashboard. So we are ensuring not only that we have an incentive for the students to share that information because then they get an excused absence, but we're also making sure that information is provided transparently with the campus community.
And that answers the next question that came up. So you handled both of them at the same time. There's a question about the counseling center. So we will have counseling services available just as we did last fall. Students who elected to be in person were able to be in person, and students who wanted to do the virtual sessions were able to do so as well. So we'll continue that practice in the spring.
There's a question about a specific fee and whether it will be refunded if we remain in remote status. I think it's safe to say that that the president and this cabinet will continue to evaluate those questions if we remain in an extended period of remote status, which we have a high level of confidence that that will not be the case, but we can assure you that we will continue to make decisions in the way we have in the past, which are in the best interest of not only the students, but the institution. Before I turn it over to other members of the cabinet and the president, I just want to say thank you for attending today's town hall. Clearly, our decision, it does not make everyone happy, but we believe that this is in the best interest of the safety and welfare of our campus community. We feel confident in our faculty that they will deliver on the live synchronous experience during the 2 weeks of the remote period. And please know that we take very seriously your comments and your feedback. And as I said earlier, I've made my contact information available to you during this town hall. There are others on here that you can also easily find their contact information by going to the website. No question is too small, and we're happy to be here to be of assistance and to make sure that this is a productive semester for you. So thank you.
I would just add to that, we're looking forward to seeing you all back on campus as soon as possible. Hang in there, and just remember, when the going gets tough, Rams up. We stay up, we show up until the work gets done.
And just to reiterate, none of us wanted to have to take this action. We believe that this is the action that's in the best interest of the campus community, not only in terms of safety, but in terms of the opportunities for success for our students. In a world of uncertainty, we're trying to take the course of action that we think minimizes the potential harm, the potential risks. And we thank you for being here today, for having your good questions. I'm sure additional questions will arise, and please forward them to us. We do monitor what comes in, and if we receive questions that we haven't addressed already, we'll certainly be prepared to answer those questions. Is there anything else anybody wants to say in closing? Megan, any final questions popping up anywhere?
That's all we have.
Okay. Well, then, thank you all very much for attending, and we hope this moves forward the way that we expect. And so far the number of cases is trending in our favor, and hopefully by second week of February we're just going to be back to normal, and as normal can be in this world, and we can move ahead with a solid semester. So thank you all. And we look forward to you all continuing your education.